live, there are people affected by homelessness. You think about their lack of shelter and how hard it is to get food, but what you probably don't think about is their lack of access to healthcare. 95% of homeless people have unmet health needs. After having discussions about this in a theology class, my eyes have been opened to a basic need that we have all been forgetting about. Although many of us have not experienced homelessness, if the people experiencing this cannot get preventative and routine medical care, health problems become more serious and costly. People experiencing homelessness often need to rely on emergency services, which can increase healthcare costs and put a strain on hospitals and taxpayers. Today, I want to inform you on how the lack of healthcare access for people experiencing homelessness developed, the barriers that prevent them from receiving care, and some consequences that they face. To start, we'll look at some factors that have contributed to this issue. So these factors did not develop the issue, but they continued them and worsened them. So the community mental health movement was in the 1960s to 70s, and the goal was to move people out of mental hospitals and into a more communal setting. So the long-term psychiatric hospitals were defunded and closed, and then the communal settings that were supposed to happen didn't get enough funding. So a lot of patients were released without any places to go. And this created a cycle of lack of access to healthcare because most people went homeless. And untreated mental illness makes it difficult for people to get and maintain a job, relationships, and stable housing. So, according to the National Library of Medicine in 2025, the community mental health service system is least effective in providing treatment, maintenance, and rehabilitative services. Thus, mentally ill people who have been discharged to the streets or who have been displaced from a housing situation are less likely to continue to receive the necessary array of services. Another event that worsened the lack of access to healthcare was the COVID pandemic. People lost their jobs, couldn't pay rent, and became homeless. So there were more homeless people on the streets and in shelters, and then everyone experienced a lack of healthcare. But specifically, it worsened it for people who are homeless. So a lot of clinics switched over to telehealth, which was great for people who had access to the internet, but people who are homeless don't have phone, tablets, or internet and can't use this service. And then also, there was a greater risk of spreading of diseases because people in shelters can't social distance because there's so much overcrowding. And then people on the streets don't have preventative measures like masks or may not be able to wash their hands. So while these factors help explain how the issue is developed, they don't tell the whole story. Even today, people experiencing homelessness face significant obstacles when seeking medical care. One of these barriers is a lack of insurance. Without stable jobs, it's really expensive to get medical insurance, so most people don't have it. And people without insurance often avoid having their routine, preventative, and emergency healthcare needs met. Healthcare is very expensive without insurance, and people who are homeless have to make decisions every day about how they will spend their money. This usually means that they're spending it on food to survive, and their money is not going to go to expensive doctors or medicines. Also, people who are struggling financially are probably spending their money on fast food, which is unhealthy and worsens their health even more. But fast food is like all that they can afford. Another barrier that they face is stigma. So we don't think about this very often, but a nurse said this in 2013. Healthcare for the homeless is often a broken system, being stigmatized for being homeless, lack of care through the health system, disrespectful treatment, and feeling ignored by healthcare providers. So even the nurses, like in the hospitals, are noticing this issue. And many people assume that people who are homeless choose it or did something wrong to get there, but that's not usually the case. Unexpected family issues, natural disasters, and unemployment can cause sudden homelessness. And when people have these assumptions that it's their fault, they're less likely to help those that are homeless because they like to just place the blame on someone. And people struggling with homelessness feel a stigma and are embarrassed to ask for help, including for their health. So something will be wrong and they won't even try to get it fixed because they know that they're going to be faced with criticism. So now that we've looked at some barriers they face, it's important to recognize the serious consequences these barriers have on health. So one of these is increased emergency room visits and hospitalizations. So a financial strain is put on the hospitals and taxpayers because homeless people are using the emergency resources for things that could have been solved with preventative care. And they're not using preventative care because they don't have insurance to make appointments or they're just not able to access these options. So they're forced to go to the emergency room. And when they can't pay, it puts a strain on the hospitals and then on the taxpayers because they end up having to pay more later. So this is a graph from the CDC in 2023, and it's showing hospitalizations of people who are homeless and not homeless. So over time. So this line up here is for homeless people, and then down here you can see the one that's like pretty stable is for non-homeless people. So you see how much that more they're using the emergency services and that it's increased a lot over time. Another consequence that we're seeing is higher rates of untreated mental illness and substance use disorders. I talked about a little bit with the community mental health movement, but we're really seeing it more because without treatment and support, mental health issues and substance use disorders can worsen, leading to more severe symptoms and increased risk of self harm. And this creates a cycle, like I talked about before, because you can't get a job and have it stable, so you can't afford housing. And then you have a whole life with these disorders that you can't get treated. But as I've talked about today, improving healthcare access for people experiencing homelessness requires understanding both the challenges and the consequences that come from them. To start off, I explained some events that have worsened the lack of access to healthcare for people struggling with homelessness. The community and mental health movement and the COVID pandemic did not cause homelessness, but they contributed to the worsening cycle of lack of healthcare access. When trying to receive healthcare, homeless people face many barriers, including not having medical insurance and stigma for being homeless. These barriers lead to many consequences that affect them and the larger population. More emergency room visits and hospitalization leads to strains on hospitals and taxpayers, and higher rates of untreated medical illness and substance use disorders is dangerous for everyone. The health of a community is measured by the care that is available and who is able to receive it. I hope this reminded you all that a person's housing status should never determine whether they have the opportunity to receive the health care that they need.